What's up, everybody? My name is Kwa, and welcome to another Live Talk COVID-19 series. I'm here representing the U.S. Pan-Asian American Chamber of Commerce, serving as the president for the Northeast region. And today we have an exciting topic that everyone's talking about, which is reopening the economy. But except that I'm not the expert to talk about it. We're going to bring some experts on board and have this conversation. I'm also not going to be moderator. We're going to bring a special guest to moderate today's show. But before that, let's do some preliminaries. Make sure that you're hitting the like button on Facebook. Send your comments out. Go to USPAACC.com. We're also streaming over there, streaming live, and as well as send out your comments on YouTube. So with that, let's get started. So with us is Susan Allen. She's going to be moderating this session. So with that, take it away, Susan.
Thank you, Kwa. And hello, everyone. I'm Susan Allen from the U.S. Pan-Asian American Chamber of Commerce, and welcome to Live Talk, a responsible and realistic plan to reopen the economy. Americans are cautiously coming out from their homes and try to reintegrate into normal daily lives. But we cannot relax because of this coronavirus, which is on top of all our minds. How do we get back to normalcy? Will we ever? And where do we start? Joining us today is Dr. Lanhee Chen from the Hoover Institution at Stanford University. His writings have been published in the New York Times and the Wall Street Journal, and he appears on national television as a commentator on American politics and domestic policy. And he has a plan. Hello, Dr. Chen.
Hello, Susan.
What are the major factors that should influence public policies makers' decisions in reopening the economy?
Well, first of all, thank you for having me, and thank you for convening the conversation on this very important topic. I think anytime that public policymakers consider a question like reopening the economy, it's always a balance. And obviously, for the last several weeks, the emphasis of policy has been on public health. It's been on trying to stop the spread of the virus to ensure that the healthcare system is not overloaded. But now that policymakers begin to think about reopening, it is important to balance public health considerations against the very real economic reality that America faces. We have tens of millions of Americans who are unemployed. We have an economy that's basically completely stopped. It's affected many sectors of the economy beyond just travel and leisure, which is the obvious one, but small businesses like your members and members of other chambers of commerce around the country have been affected in a very significant way. So we have to figure out not just how to respond from a public health perspective, but recognize that there are significant tolls that are being taken on businesses, on livelihoods, and the impact of coronavirus shutting down the economy is more than just lost revenue. It's also, there are also healthcare and health-related impacts as well. So policymakers have to be careful to balance the need to ensure that we are stopping or curbing the spread of the virus against the economic reality that a shutdown of the economy in any substantial way for an extended period of time is simply not tenable. So I think you're starting to see policymakers begin to try and strike that balance as states reopen and states begin to come back online.
Now, with COVID-19 a part of American lives, what are the realistic expectations of its impact on our society?
Well, I think a few things. We have to realize that that a new normal is here. The way that we did business, the way that we interacted with one another before we knew of this novel coronavirus, this COVID-19, before we knew of that, you know, the way we interacted with each other, the way we did business, I think a lot of that's going to change. So let's talk about a few ways that that's going to happen. First of all, I think increasingly remote work, work from home arrangements, flexible work arrangements, these are going to become a standard part, a standard operating procedure at many companies around America. We've developed some muscle memory around this over these last several weeks and months, Susan. I think that's a good thing. We have a better understanding of how companies are able to function in an environment where not every single worker is in a single place of work. We're used to a diffuse set of work arrangements, and I think that will likely continue. A second thing I would say is increasingly employers are going to have to play a bigger role in evaluating the health and well-being of their workforces. And the federal government and state governments are going to have to be partners in this, but you might see things like temperature checks. You might see things like increased training around social distancing and hygiene in the workplace. Prior arrangements where you saw certain workplaces being acceptable with greater density of workers in one place, that may have to change as well. So the nature of the workplace itself and the relationship of the employer to the employee, that may shift as well. And one last thing I'll mention is travel. You know, travel was an integral part of our lives in business life before coronavirus. Travel is going to change. I think the extent to which people are traveling will, for the next several weeks and months and maybe even the next year, not be the same as it was before. The way that people engage with one another, we're going to be doing a lot more of this remote engagement, because the reality is it's going to take a lot more work. There's going to be a lot more involved in getting on a plane or getting on a train to go somewhere. And I think those kinds of restrictions or those kinds of limits that we're seeing are things that, by the way, responsible members of the travel industry themselves are talking about implementing. Those changes are also going to be here for some time. So we are in a dramatically different normal now when we think about how we work and how we interact with one another in professional settings.
Lanhee, you have just published a book called Reopening the Economy. And there's a point that was quite interesting to families, and I want you to talk about that. Why do you think that reopening schools is so important to the success of the economy, and how do you propose for that to happen safely and successfully?
Well, this, Susan, is critical. The availability of K through 12 education in the in-person setting. Obviously, many of us have gotten used to seeing our kids being educated over Zoom or over WebEx, or doing it in a remote fashion. But that will never replace the in-person interaction between student and teacher that is so valuable to childhood learning and development. I think the K through 12 schools are really, really important for a few reasons. First of all, we need our kids to be educated in that setting. We need them to progress. That's one thing. But the second thing is it's very hard to get an economy up and going if you don't have schools to send kids to. Parents have a tough time getting to work. Parents have a tough time participating in the economy in a full way if their kids are not going to school. So the opening of K through 12 schools is important, not just for educational or didactic reasons, but also because it's important to get the economy going as well. We have a plan that we've put together that we're going to talk about a little bit more over the course of our time here. But one of the keys to that, we believe, is responsibly opening K through 12 schools as we move toward the fall. But it's not going to be school the way we knew it before. We're going to have to think, for example, about combining distance learning with in-classroom learning at times. We're going to have to protect kids who have caretakers or parents who are older, or who may have comorbidities, who might be at risk of more severe consequences if they were to become infected with coronavirus. So we have to think about how we take the traditional classroom setting and change it. As I said, involving distance learning, thinking about social distancing within the classroom, maybe in climates that allow for it, having more outdoor classroom sessions, because there is some initial medical evidence that suggests that COVID-19 is not transmitted as easily in outdoor settings. So we have to think about how you combine all of these things. But fundamentally, Susan, here's the point. What we know with all of the medical data that we've seen from coronavirus around the world, and this is one thing that we can feel fortunate about, is that kids who are of school age tend not to be as seriously affected by coronavirus. They tend to have a higher number of asymptomatic cases. They tend not to be able to pass it as easily, at least as the evidence suggests so far, obviously preliminary. But all of these pieces of evidence suggest, just to go back to my original point, public policy is about trade-offs. And if you're thinking about making trade-offs, one trade-off that I think and my co-authors and I believe is important to make is to bring kids back into that school setting sooner rather than later for all of the reasons we've discussed. And we believe it can be done in a relatively safe and responsible manner.
Well, I know what you mean. One of our workers, employees in the office, had a 4-year-old, and she's been working at home for the last 7 weeks, and it's been very destructive to her and very distressful for us because she's responsible for accounting, our finances, and we rely on her to tell us how much we have coming, how much we're going. And when she's not working, somehow we feel that we have to stop too. So please get that going. Another question, Lanhee, what role can employers and businesses play in our ongoing fight against the coronavirus?
Well, let me just say, I think that one of the remarkable things about our fight against coronavirus has been how valuable employers, businesses, the private sector have been. My own personal view is that what makes America a unique place is the free enterprise, the healthy free enterprise system we have, where you have employers interacting with government. You know, this coronavirus crisis was never going to be solved by government alone. A lot of people around the world have experienced what happens when you sort of give government the sole responsibility for solving a problem. It doesn't go very well. And things work well in America when we see the private sector working together with government hand in hand to bring about solutions. It's the only reason we're as close as we are to an effective therapeutic against coronavirus, because of the tireless work of companies and researchers within those companies who have committed a lot of their time and energy to finding a therapeutic, a vaccine in the same way. The reason we have functioning distance learning and distance communication capacity is because of companies that have come online to pioneer that technology. So employers have already played a huge role in fighting the coronavirus. But going forward, we've talked a little bit about how the workplace will need to change, and employers should be interested in trying to keep their workers healthy through, as I said, regular means of determining the health and well-being of their workforces and ensuring that they have a workplace that's safe for workers to return to. Government needs to partner with employers. This is not employers alone. Government should think about providing incentives to workplaces, for example, to engage in regular testing of employees. At this point, we have a relatively reliable test, and it's called an RT-PCR test that determines whether one has an active coronavirus infection. Hopefully within the next 6 months to a year, we're going to have more accurate antibody testing, which will determine if one has developed antibodies that are protective against coronavirus. Once we have that testing come online, we'd love to see that come into the workplace more. So it's got to be a partnership, Susan. Employers are going to have to work closely with their employees, as well as with local, state, and the federal government to implement the kinds of changes to keep workforces and workplaces safe.
You wrote a book, as I mentioned earlier, where you set out a plan on how to implement a realistic and responsible plan to reopen the economy. Can you briefly describe that, and how might your proposal be put into action?
Well, let me highlight a few things. I'd encourage everyone to look up the study and to look at the report if they're interested in some of the detailed ways that we do it. Let me just talk a little bit about why we wrote this plan. We wrote this plan because we're all optimistic by nature. We want to be optimistic about a vaccine coming soon. We want to be optimistic about effective therapeutics, but we also realize that it's very hard to develop effective medicines and effective vaccines against coronaviruses of the type that we're seeing with COVID-19. So the plan is really designed to provide suggestions to policymakers about how you responsibly open an economy When you don't have those things, when you're not sure when that vaccine is coming, you're not sure when more widespread testing is going to be available. And so we outline what we would call a realistic scenario for reopening the economy. We've talked about a couple of these key elements already. One is getting those K through 12 schools back open again. I also would advocate that we need to figure out a way to bring in-person instruction back to college campuses this fall. I think that's critically important. A second element is the workplace. We've talked about that. Workers partnering with employers, partnering with the government to ensure there's effective the testing in place in the work site to evaluate and identify situations where there are potential outbreaks. Contact tracing. We talk about the value of putting in place good contact tracing, which is a basic system to ensure that when you know you have a confirmed case of COVID-19, you're able to trace the interactions of an individual who's been infected to begin the quarantine and isolation process so that the virus does not spread further. We talk about the importance of ensuring that travel is back online again. We spoke a little bit about that, but that's going to involve, for example, bringing a requirement that people who travel, who are on airplanes, have had a recent coronavirus test. Masking is going to become universal, I think, on airplanes for some time. Promoting greater hygiene on flights and on travel trips in hotels and with car rentals. Those are going to be important as well. And then I'll just mention one other element of the report. We talk about the value of ensuring the healthcare system is prepared for the next. We know there is going to be another spike, another outbreak in all likelihood. The healthcare system, this is the time to get ready, to ensure that the surge capacity is available, to make sure that we have appropriate amounts of ventilators and protective equipment in our hospital settings, but also taking a good hard look at how we are bringing patients into the acute care setting so that we don't have hospitals overwhelmed. We don't have facilities overwhelmed if and when that happens again. Having a plan ready and available, working with local governments and state governments to put together plans. And the last thing I'll say is this, Susan, we need to do a better job of coordinating between state governments. You know, one of the things that I've been advocating for, if you've got a solution, we've seen some great leadership out of the state of Maryland. Governor Larry Hogan has been tremendous. We've seen great leadership out of other governors around the country as well. What I would say is those governors need to be coordinating with each other, because you can have a solution that works in Maryland, but if you're not coordinating that with Virginia and DC, it's almost worthless. Same thing here in California. If we've got a strategy in California, that's got to be coordinated with Nevada and Washington and Oregon and surrounding states. So we need to see much better coordination between states in terms of thinking about what reopening looks like and how we do it responsibly and effectively.
Thank you, Lanhee, for sharing your valuable insight and your rational plan for us to move forward.
Thank you.
And to our audience and our viewers, we appreciate your tuning in to Facebook, YouTube, and USPAACC.com. So join us, write to us, because we also want to hear from you. Take care, be healthy, be safe, and be happy.